Hi everybody, Dr. John Hayes, and welcome once again. Today I want to supplement some of the talks that we started last week. One of the last videos we did, we talked about the research study that indicated that vacationing more often, the upshot of which is stress reduction, can have a significant bearing on metabolic syndrome or prediabetes, something that we've spoken about quite a bit here in the past, and we've written about it extensively the last several years too. If you want to learn more about it, there's a number of articles on our blog, and also we talked about this both in Beating Neuropathy and the book I Beat Neuropathy. But here's the upshot. So intermittent fasting is a period of time which can vary. It can vary from as little as 6 hours, but sometimes can go as long as a couple days and sometimes even longer, where you don't consume any food. You simply drink water, and that's it. Now, there are other modifications on this too, and one of the caveats, though, is if you're insulin dependent, especially, and or you are on anti-diabetic medications or medications that can induce low blood sugar or hypoglycemia, you must do this with physician supervision. Okay, I said physician supervision, not dietitian supervision, because it can be treacherous, it can be dangerous, especially with insulin. So don't play games with this. But intermittent fasting, as it turns out, is basically going an extended period of time without eating food. And you know, some people actually do this intuitively. Like I remember my father-in-law, for many years, he was thin his entire adult life, and he really only ate one meal per day, which basically meant he had a pretty good-sized meal, mid-sized of the day, had almost nothing for breakfast and nothing at the end of the day, and basically went through his entire life with no lipid problems, no heart disease, and so on. So some people just naturally do this out of habit, but what has become way more common in our society is eating too much and eating too much too frequently, especially with regard to carbohydrates. But what does intermittent fasting or periods of not eating do for us? What are the potential benefits? Well, the upshots are pretty significant when we take a look at the research literature, but perhaps one of the most exciting pieces of research, and one of the reasons that I selected to talk about this a little more today, is that it turns out that intermittent fasting may actually help the body recruit its own stem cells, meaning it can help create an anti-inflammatory environment in the human body and also speed the healing process. And also it can improve blood sugar parameters, hence, you know, metabolic syndrome, prediabetes, and possibly a whole host of other things. Is it a cure-all? No. There's nothing, ladies and gentlemen, that cures everything. There's nothing that helps everything or every patient. However, intermittent fasting has turned out to be a tool, which is why that when we rewrote the ND diet plan a couple years ago, we included periods of supervised intermittent fasting in there. So here's what works for a lot of people. One of the nicest ways to intermittently fast is to start by simply placing a significant interval in between your meal consumption. For example, you can have dinner earlier and then not consume anything until mid-morning as opposed to early morning. That's one way to do intermittent fasting. Another way of doing it is to have a relatively small meal in the morning and then not eat again until much later in the day. Those are kind of mild, gentle variants of intermittent fasting you can use. And there also are what we call the medically supervised fasts, where we actually have patients go for a significantly longer period of times. However, the key is, like I said, you must work with your physician if you are insulin dependent or are on any medications that can affect your blood sugar. Other cautions you have to be aware of is you need to make sure that you don't have abnormal kidney function, and also you need to make sure that you stay extremely well hydrated. Consuming a lot of water during periods of fasting really can make a big difference too on how your body eliminates waste and so on and so forth. So if you have any more questions about intermittent fasting, what it can do for you, and how it may help you, please feel free to post them below. As always, though, this is something to pay attention to. Learn more about it. If you have more questions about it later, or you'd like us to do additional videos on it, we'd be more than happy to. All right, once again, I hope you find this information helpful, and please, if you like our information, you value it as much as a lot of people are telling us, please make sure that you share these videos, share them on Facebook, share them on Instagram, share them with your family, and don't forget our vast library on YouTube. All right, everybody, thanks so much. Take care, and we'll talk to you soon.